Good evening, everyone. I would like to welcome you to our October AABIP webinar on behalf of the moderators, Dr. Wei Low, Majid Shafiq, and myself. Before formal introductions, we will go through a few housekeeping matters. First, everyone please note that this webinar will be recorded. It, along with previous and future webinars, can be viewed on the AABIP website and can be found under the Education tab on the front page as shown here. So next, a couple of important disclaimers. During the webinar, please note that the audience will be muted, so you will not be able to verbally interact with the speaker or audience. However, you can certainly ask questions and communicate with the group during the webinar, and we encourage this. So all you need to do is type your questions or comments into the chat box or use the Q&A function. Both of these can be accessed by clicking on the chat or Q&A icons located at the toolbar at the bottom of your screen as seen here. Please make sure that your chat is set to direct to all panelists and attendees so that we, along with the entire audience, may see the question. We'll keep track of the questions as they come up and address them toward the end of the session in a formal Q&A period. Some of them we may address during the talk, so please feel free to type them in at any time. So next, we would like to be clear that the AABIP does not endorse any specific technologies or products, and that the content and views expressed within the webinar represent the opinions of the speakers and do not necessarily reflect those of the AABIP. So now that we got that all out of the way, I would like to introduce our topic and our speakers tonight. We are very excited to have a panel of knowledgeable, motivated individuals here to speak with us tonight about how to prepare and submit high-quality session proposals for the AABIP annual conference. This webinar is going to be an interactive panel discussion, a little unique compared to some of our other webinars, so I'm really excited about that. The webinar will be moderated by Dr. Hans Lee, who's the IP Fellowship Program Director at Johns Hopkins Medical Center. And with that, I will hand it over to him for additional introductions.
Great, thank you. Let me just share my slide here. Super excited for being able to moderate this portion of the webinar on how to submit a high-quality session proposal. This was a session that I wish I had available to me earlier on in my career. But what's more exciting is the panelists that we have here tonight for you. And so what I'm going to do is I'm going to ask them to introduce themselves and tell us a little bit about their role of on this topic submission proposals.
Well, thanks, Hans. I'm Darlene Nelson. I'm an interventional pulmonologist at Mayo Clinic in Rochester. I have an interest in this just because I like medical education and have worked hard to create high quality session proposals before. And so I was really honored to get an invite. Just as background, I'm also the pulmonary critical care medicine program director here at Mayo, and then have a master's in health professions education as a background.
Hi guys, my name is Jenn Duke. I am the Interventional Pulmonary Fellow here at Vanderbilt. When I think about my exposure to session proposals, it really started as a second-year pulmonary critical care fellow when I was at Mayo. I had a leadership role where basically I had this group of fellows that I was entrusted to submit session proposals to the big society meetings. And so I can tell you that as a fellow, it was hard to initially start, but it got easier every session that I went. And so I'm excited about our conversation tonight.
Good evening. Super excited to be here, as Hans said, and thank you for inviting me to be part of this. My role would be relatively minor. I am the current president of AABIP, and with that job, I'm also the chair of the Planning Organizing Committee. I would do the same. I would share with you whatever I learned in more than a decade of doing education for AABIP and CHEST and other organizations.
Hello, everybody. My name is Jasleen Pannu. I am the current scientific program chair and actively planning the scientific program for AABIP 2024. And in my role this year, I'm very excited to create the scientific program to bring in new things and ideas. And my involvement with submitting session proposals, reviewing them, and then choosing them, the whole spectrum has been probably last 5, 6 to 7 years. So it has not been that long. So I can appreciate how things start and then how they can progress over years as we learn to get better at the craft. And I've also seen how much interest at conferences is amongst attendees to talk about certain things, to bring them out into proposals, and where we talk about, let's do this next year. I hope there was a session on this and it would be a great session. And I'm here to talk about how that all is actually real and not that tough to achieve. And actually, program organizers at most conferences are looking forward to hear from proposals like this and how they can be presented properly. I'll be very excited to talk about that.
And I'm Laura Frye. I am the scientific program co-chair along with Jasleen. And last year I was actually one of the content subcommittees. So I was the co-chair of the track on advanced diagnostics. I have submitted successful and unsuccessful submissions to ATS, CHEST, ISHLT, you name the society that we're a part of. I probably try to have a session there. So happy to chat about lessons learned from those submissions in the past.
Wow, fantastic. I feel honored to be in the presence of such greatness right here. Certainly very influential people with the submission process. Just some housekeeping things. Looks like the meeting is August 22nd to 24th next year, and the submission deadline, it's around the corner, October 25th. Let me ask, can people start to submit now? And where do they go to submit their sessions?
Yes, absolutely. The session proposal site and the link has been open now for about a week. And I think towards the end of the slides, we'll post the link, but on the AABIP website, as well as our social media links, the link to join has been distributed to try to, and the link has a direct link towards the website, as well as the .form that is there to submit these proposals. If you are an AABIP member, you should have got an email, maybe a couple of them now, for a link for this webinar, as well as to submit proposals.
Oh,
so
great.
yes, it's absolutely active.
Yeah. And if you're interested in helping to shape the meeting by being part of one of those content committees, that RFA is open and actually closes this week. So that is on the website as well.
Wow, on the first slide, we already have an open opportunity for people to join in on the AABIP session planning. That's amazing. Let me ask the panelists this first question. If I'm new to creating or submitting a session, how long does it take to submit a solid submission?
I can take maybe a start at that. It depends on really, one, the kind of idea a person has, and how committed you are to make it, however solid. It can be a very quick submission without much details attached to it, or it could be something that is more comprehensive, that can totally take more time. I think the correct answer may be somewhere in between. I would say if you had to really think up a good session, I think it should not take you, at least to find an outline of that session, more than a few hours. Definitely one can think up a couple of at least good sessions within a day. Now, it's always a good idea to think up a session and then come back to it and try to reach the speakers and try to collaborate on it a little bit, so that it can reach a more comprehensive picture. But it's totally possible. It doesn't take weeks or months.
Oh, wow. No, I'd love to hear from one of our youngest panelists on this group, and I see her smiling, laughing already. Jenn, who's an IP fellow. No one's busier than an IP fellow. Jenn, how long do you think it takes to submit a quality session?
Yeah, I completely agree with Jasleen. I think it depends on your exposure to the topic beforehand. So if you eat, breathe, sleep malignant pleural effusions, then it's going to be easy to think through some of those things that may be more interesting to the general community. I think one of the things that I learned from submitting sessions in the past is The work that you do up front may take a little bit of time, but it actually makes the session easier if it does get submitted. For example, we'll talk about objectives later on, but I think if you really focus and you think about what you're hoping your audience to achieve after this presentation and think about that ahead of time, it may take a while at the beginning, but by the time you're gearing up to actually giving it, you really appreciated the time you put at the beginning. The whole proposals tend to be word limiting. So that's also something that if you are a young faculty or an IP fellow or even a general fellow, I saw a lot of fellows at our AABIP conference in Chicago. Those are certainly things that are something that is attainable and reachable even with a busy schedule.
Right. Well, I had a chance to peruse the website for submissions. And so I thought we take it step by step to gain your wisdom about how to submit a session. And one of the first fields I came up with after putting in my fake name was the session proposal category. What do you guys think about these categories? Any one that speaks to you guys or you have more experience with? I would love to hear about picking a particular category for a session submission.
I'll jump in, I guess. So I tend to pick a category of an area that I'm interested in or interested in learning more about, or at least networking with other people about. So maybe I may not be the world expert in it, but it's something that I would love to learn more about. So one thing I just wanted to say is you can submit a session proposal and recognize that it's not your area of expertise. So you may not submit yourself as one of the speakers in that, but that doesn't mean it's not a great idea and an opportunity for you to still effectively contribute to the scientific program at the meeting. So for myself, I've often submitted in education as that's an area of interest of mine. And I usually try to pick a hot topic, something I think others might be interested in, or an area of controversy or an area of knowledge gap. Those are three kind of big ones that people are going to be probably most interested in attending. So I'd love to hear what others, yeah.
You shouldn't be afraid of submitting a session, even though you're not a Tim Murgu or a world expert on anything. It's okay to submit something.
Oh, absolutely. I've failed in this, but I've also succeeded in this. And sometimes just it's been a good experience to talk to people who are world experts and then just submit the session proposal. And I've learned a lot in the process.
Well, let me ask you guys, since you mentioned about failure, I certainly failed at a lot of things, including session submissions. What do you guys think about submitting sessions? I think a lot of people are afraid maybe to submit something because of failure. What was your first experiences like? And maybe you can share a story.
Yeah, I've definitely failed in submission proposals. I think one of my very first was the session to ATS, and we decided that we were going to do a session on coaching and how do you do procedural coaching. And we had this great idea to use Legos and have it be interactive and have this, really advanced educational experience. And I think what we didn't really appreciate was that as fellows, we didn't have the perspective of what it was like to be in that teacher role like some of our mentors had. And so that was ultimately not chosen due to a lot of different reasons, but it really impacted my group's decision with the following session proposal, specifically saying, well, what do we have as fellows that may be interesting to the general public, a perspective that maybe we could provide. And so our most recent one was really geared towards that population and a need that we found within the trainee environment that could be filled. I would say also that one of the things that can be helpful after a failure is reaching back out to the committee and getting some feedback on the proposal sessions. So we have a great community here at AABIP, and I think that getting that feedback of maybe why it wasn't selected could enhance your future session submissions.
Wow, great. So you don't have to be the world expert. You don't have to be afraid of failure. It's good to get feedback. I've attended a lot of different meetings over the years, and I see a couple of proposal categories that I don't normally see at a lot of meetings. For example, the innovations in entrepreneurship and miscellaneous. Can you guys kind of expand a little bit on what those categories might look like?
So the field of IP is so unique that it is innovation and entrepreneurship is very uniquely tied up in this, how much we work with industry, how much new techniques, devices are coming up every few months, and how much of our own IP physicians are involved in startups, in companies, and in new products and innovation and patents ourselves. It's probably very unique to IP. And this was added to the session categories, I think now 2 years ago, to highlight this very special aspect of the field. So it particularly caters to those topics that may not have that much evidence attached to them now, those futuristic ideas or very initial prototype sort of projects or devices that may be starting up, or how to start them up. And not only just between the physicians, but the collaborations with industry in that, and different aspects of how this part of a career can be grown, and sort of a look into the future. And miscellaneous is more of a potpourri of topics that keep getting relevant every year, and may not at this time warrant its own kind of category, but it's quite important. Like recently, reimbursement, accreditation has become really important, and it's basically says that there's no restriction on what topic to propose. There's an open forum, and this is that box where almost everything which a submitter finds to be relevant can be submitted.
So it sounds like really anything's game for the AABIP meeting. So it looks like the first field is something that I think everyone can submit something. And my fellows say that it rains pleural disease every day and every night. So that may be a great topic. And I see a lot of other interesting topics for me. And sounds like Darlene eats, breeds education. So we're probably going to see an education submission maybe from Darlene. That's fantastic. So let's go on to the second field of the session proposal. They ask categories, and now they ask for these types of sessions. And I'm kind of familiar mostly with the plenary, where Professor X, comes back up to the podium, gives a talk. But these other sessions look pretty interesting. Can you guys expand and maybe give me an example of maybe something that was submitted last year, or something that you've seen in other meetings?
So, yeah, you're very right. The plenary and, more didactic breakout sessions are pretty conventional and traditional way of interacting at conferences. And we like to innovate ourselves. So several of the categories that here we have added is our way of encouraging interaction. Maybe if it's even one-on-one, if it's not something that is attended by, say, hundreds of attendees, maybe it's a smaller group, and maybe it's relevant to a certain kind of attendee, or a certain specialty, or a certain subspecialty in the conference. So these topics specifically, like meet the professor, means that a certain expert in a very specific field, world-renowned expert, may interact one-on-one with a small group that may be very relevantly interested in that topic, and have that high-level discussion about a certain field that a lot of people, hundreds of people together in a plenary session, may not be able to effectively have. Similarly, problem-based or case-based learning is almost about very specific scenarios, clinical real-life scenarios that can be highlighted, whether it's related to a procedure or a technique, or a medical problem that is unique and may not have been practiced in a large scale, but only maybe a small group or a specific group of physicians or advanced practice providers, and they can be discussed in very specifically with the nuances of each and every case, and understood with back and forth discussions, rather than a didactic flow of information that is more one way. So that may include roundtable discussions, that may include actual problems that a group intervenes on or comes up with a solution and shares with the whole group and then gets feedback from. So they are more one-on-one interactive sessions.
Well, I see one session here that kind of catches my eye. I know proceduralists and interventionalists, we have the stereotype of having very strong personalities. So I can't imagine what a pro-con debate looks like at an AABIP meeting. Was there a fight that broke out last year's My Dying Question?
There were no fights in any sessions last year, but I think this is an opportunity for us as a field to share those strong opinions, because there is a lot of gray in what we do. And so in those areas where we don't have hard evidence, this is our chance to have sessions where take those experts in the field and have them stand on the stage and tell you why they do what they do.
Oh.
And the other thing I'd say about these sessions is, like, don't be afraid to marry the certain session types. So maybe you take a case-based learning and a how I do it, and you have somebody work through both of those.
Yeah. And I think, Tim, you may have some story about if a fight broke out for pro-con debate, or some insight on that.
Not necessarily a story. I have an example, maybe a little later in the webinar, but I would just say that opinions are fine, but opinions can also be justified with references. And while there may be a bias in selecting the references, it's nice to see a pro-con debate where the speakers are justifying their opinions with published evidence. And then you have the rebuttal, right, where you can push back, and eventually you may even ask the audience to vote on who the winner is. It keeps it competitive, it keeps it fun, and definitely an engaging way, especially for our field where there may be a lot of gray areas. I mean, think, I don't know, stent trial for tracheobronchomalacia, as an example. So I know it can be quite engaging modality. We have not tried it in the very recent past. I have seen it done successfully at other meetings. So that's something to please consider for this year.
Right. So a question just kind of came in about simulation, and asking, can we propose a simulation session for the meeting? And I don't necessarily see simulation listed here, maybe other than other, but what do you guys think? We do a lot of procedures. Simulation makes a lot of sense. How can I incorporate simulation as a session proposal?
There will be simulation at the meeting again this upcoming year. If you are interested in helping sort of develop those sessions or be faculty even for those sessions, there's also an RFA to be the session champion. We've sort of outlined what we anticipate those will look like, very similar to what we did this year, but with some additional topics. So I think we're reaching a broad audience with the simulation that we'll be offering.
And Laura, who or where can they contact someone if they want to be more involved with simulation for next year's meeting?
You can send me an email. It's on the website.
Awesome. Awesome. Thanks. That's what I was looking for, Laura.
Yeah. Okay. Make one more comment. It's more pertinent to the slide that you showed before, but I can make it here. You don't need to go back. In regards to the submitter submitting a session that they may not be part of, I mean, that's fine. We have done that. And some of those sessions get accepted. And it's very altruistic behavior, I believe. But there is something lost when the submitter is not part of that panel, as a speaker or as a chair or as a co-chair. To have that unifying theme, to keep that panel engaged and communicate prior to the meeting, to align in terms of learning objectives, I would suggest the submitter, one way or another, is part of that panel. So please consider that as well.
Exactly. And most conferences, including AABIP, will actively try to do that, to engage even if it's a more early career faculty, or even even if you're a fellow, to at least step in to moderate the session. If you have designed the session, you have built the session, and yes, you're not an expert at this level, but you can definitely be involved And in most sessions, at least in moderating as a chair or co-chair, which is an incredible opportunity to get familiar with how these sessions are carried out and how they are structured, and how an experienced speaker will speak and an experienced moderator will moderate. That was the first time I was introduced. That's how I was introduced to speaking at these sessions. So my first engagement was as a co-chair. So
Right.
that's incredibly useful.
Right. So I thought I'd kind of showcase 2 sessions, and based on the AABIP session format submissions. And I'd love to hear the panelists kind of give some advice or things to do or not to do. I know the first thing that comes up is the title. Is that an important part of the submission?
Absolutely. I think the title is something that, some people say do it at the end, some say craft it at the beginning. But I think wherever you do it, you really want to make your title engaging. You're not trying to summarize your entire presentation. The session description will really sell that for those who are choosing whether or not to attend the session, but the title is what's going to catch their eye.
Right.
So it's printed on the program, it's on the website. So one of the things that I think of when I make titles is trying to address the audience in a specific way. So is there a specific benefit or outcome that they'll get from this? Is there a specific issue that they want to avoid? Trying to create some curiosity, maybe some urgency in the title as well could be a consideration. So taking it out of medicine, for example, a really basic title could be something about like me and my dog, but something that's even better is, how did that golden retriever puppy change my life forever? That is the session that I want to go to.
I would attend that session. I love dogs. So a catchy title session, something that speaks to the audience. I know when I attend meetings and I'm looking at sessions, first thing I look at is titles. And that's how I pick my sessions. Did you guys have any experiences of the best title you've ever seen at a meeting?
I'll tell you, this, Hans, sometimes this title goes a long way, because even when the meeting is over and a couple of meetings later, people invite you because of the title of your previous talk that you had 2 or 3 years ago. So I remember at one of when Game of Thrones was really popular, the show was, so we had a session that we made Game of Nodules, so people were. Then so sometimes, you can go a step ahead and even dress up like that. But what it really does is leaves impression in people's minds. And, we all discuss things like nodules and pleural effusions. But what it really, at the end of the day, piques interest in that session, because it shows that the speakers, the moderators are very excited about this session, and this is going to be probably not mundane, but something that will be very high yield, entertaining, and also fun to be with. So I think that speaks a lot about the session and the speakers and the panelists.
Right. Well, I want to ask Darlene about the next session part of this session submission, which is educational objectives. And the reason why I'm picking Darlene is because we did a webinar before on something called SMART objectives, and I know she knows a bunch about it. So I know a lot of people also leave this to last because this is the hardest thing to do sometimes. It used to be for me. So Darlene, what advice do you have for everyone in the audience about objectives?
Well, thanks, Hans. With that setup, I feel like I can't go wrong. But specifically, Hans had referenced the SMART acronym, and just to make sure everyone knows what we're talking about when we refer to that, it's basically trying to define things that are specific so you can actually identify what they are, that they're potentially measurable so you can see if you've obtained your goal, that they should be attainable. You should not have as an objective to train someone to be an expert in something, because that's probably not going to happen in a 1-hour session. So it should be an attainable goal. It needs to be relevant to your audience. I think that goes without saying. You don't want to pick something that, even though I love dogs too, Jen. So I would definitely attend that session. If your objective was about dogs at AABIP, people might still not go to the session because they're at AABIP to learn about IP. And then in general, it should be time-based or something that can be accomplished during that time. So that's what the acronym means. But really, you don't have to memorize the acronym, but instead just try to think about like, what can I accomplish with who by when, right? So there's just some simple questions to ask yourself to make sure that when you're writing these learning objectives that they're actually specific, you can accomplish them, and that they're directed towards your audience. So.
Right. And I noticed the instruction says at least 2 objectives. Is it okay to write 10 objectives?
I would encourage you not to, mainly because you said you can't accomplish 10 objectives in the time period. As you may or may not be aware, most of the sessions at AAB were pretty rapid, which was great because we all have short attention spans these days. But also, you just need to be realistic about what you can accomplish. So I would say 2 is pretty max in any sort of small amount of time period.
Yeah, I'm not sure if we covered this because you mentioned about time. What is the time of a session? How long should a session would we expect to run a session should run?
So typically, at conferences, it's about an hour, and, proposing a session between 45 minutes to 1 hour will be the most common format. Sometimes slightly longer sessions, 90 minutes, sometimes 2 series is accommodated, but that's increasingly rare. So it will be best to fit in the most common format of time, which is about an hour. Now, it can be further broken into, does this need to be full 1 hour dedicated to one topic, or does it have 2 subtopics, 3 subtopics? And that's up to the person proposing the session to. We do give a free hand, of course. When you're reviewing the proposal, then the reviewers can change it according to however other sessions look like to make the most high yield out of it, but mostly it's 1 hour.
Got it. So minimum of 2 and definitely not 10 for a 60-minute session, or maybe even 90 minutes. So I brought up the body of 2 different session proposals. One of them is the Meet the Professor submission. The other one is a problem-based and case-based learning, kind of a combined one. I think Laura was kind of suggesting that people try to do that. And I see that the bulk of the submission looks like this area called scope of session, where you have to describe the session. Pretty wordy. Any advice on how to do this?
I think this, we actually increased the limit a little bit this year. Why? Because we learned that some of the times there can be an innovative topic somebody wants to discuss, whether it's more pro-con or problem-based learning, that may be a first-time topic, which may not be something very common. And this is just to leave room for describing the actual session design. So here you can see, it's pretty detailed described of how will be the room set up. There'll be round tables, there'll be 30-minute divisions. And so this is as specific as much as one can paint a picture of what they envision a session to be. It's helpful for the person reviewing it, because these are only through these words that you can see the vision of the person submitting the session. So as more clear and crisp, I think this particular submission, if it had more bullet points, probably could be, easier to read, I think. But I appreciate the fact that there is a lot of definition and structure given to what is actually the vision of the sessions. And that's really important for the organizers in terms of room arrangement and where to allot this session. And it gives a clear idea. So clearer, the better. But obviously, it doesn't have to be 400 if this can be achieved in something smaller, yes. But I don't think it should get anywhere more than that, because at that point, then we are like over a page.
Yeah. So I want to make sure we get through everything, because there's some good questions coming in. It looks like in both of these sessions, they talk about having participants sitting in a round table. Another one mentioning something called ARS. I'm going to ask the champion of ARS here tonight, Dr. Murgu. What is ARS and how can you use that?
Yeah, sure. I'll answer that, and then I'll make a comment on the PBL, because that if we apply that this year, it will be something new for the AABIP. And so ARS, Audience Response System, people can use their phones. There are all kinds of apps that can be used for that purpose. There are companies that sell clickers with the software. I used Turning Point in the past. We don't need to go and invest into that technology. We can use the phones if we want to. There are alternatives to ARS, by the way. We don't need to take this to a high-tech level. There are many other ways of engaging the audience, simply just by raising hands and showing fingers, instead of A, B, C, D, or even more fun interactive techniques where you pose a question and then you ask people to talk to each other and volunteer an answer on behalf of that small team, the so-called think, pay, or share. So the whole idea here is every now and then, as people go through their slide deck, is to engage the audience and capture their interest and have them articulate what they have learned. So that's for the audience response. Now for the PBL, I know this is a very wordy description, but the second bullet point for those interested in submitting a PBL, that second bullet point really describes what a PBL truly is. And I have to say, this is something dear to me. I learned this from Harry Colt through bronchoscopy international programs, then from Eric Dell. We have done this for more than a decade at CHEST and internationally. It's really an engaging way of learning where you give people a non-resolved case, if you want, a case description, and you just have a small team at the round table discuss it and literally write it down on a piece of paper or in a PowerPoint presentation, and then a team leader will present the solution to the case to the rest of the audience and the faculty, and then they will get feedback from the faculty, and there will be interaction with the other teams. By the way, just in terms of educational science, there is a lot of data on PBL that people have done pre and post test comparing PBLs with formal didactic lectures. And while the knowledge gain immediately after, it may not be that different compared with a didactic lecture, looking down several months, the attrition of knowledge is actually much lower with the PBL than with didactic lecture. So maybe because of that effort and engagement, people tend to retain that knowledge a little better. Plus, it engages the audience. It's really a fun way of doing it, and I'm looking forward to seeing some proposal this year.
Yeah, I think these are great when you get the audience participation, and as long as they're not rowdy, I think it's great.
I just wanted to add something really quick here. This is one thing to have kind of very well-defined categories, but there's also categories like other, or miscellaneous when that comes up. And I would like to encourage people to even explore beyond what the current categories are. So a personal example is when the current the Mission IP game, which currently is done at AABIP, when it was first proposed, I proposed it as one of these categories, and it was proposed under other. So when we say scope, it can feel to have a free hand at proposing even something that is not on the table, because if it's something, even if it's a vision, it may not be structured that much, but that can totally inspire the conference. And it's
Jasleen, just make a quick plug. What is Mission IP for the people that don't know what that is? Because that's pretty cool event.
So the Mission IP is a fun learning-based competitive event that is happening every year at AABIP now. Now it's a part of the conference, and it started as game-based learning session proposal, and now there are regional teams that are called from countrywide. This year we had all the fellows in the regional teams. The years before we've had IP teams who would compete for a trophy in a fun interactive way, and it's open for everyone to apply. So now it's one of the most peak interest generating events of the conference, but it started with a proposal, so that's how it was.
Great. I do want to also just very briefly mention about the references. because it's part of the application, and it seems like the best submissions are ones that use references to support their needs argument for the scope of the session. So I think that seems like a pretty important point. I do want us to move along because I know we're kind of running short on time, and there was a lot of questions about faculty. How do you pick faculty? Do I have to put faculty? Do I have to know the faculty members to put them? What advice can you give us about faculty?
One advice I want to just basically start with is to keep the panel as diverse as possible. And it's very easy to gravitate to your own team and your own group because you're familiar with them. But proposing faculty at different levels of seniority from different disciplines, different departments is key, because that itself makes the session very relevant to a wider audience and draws more and more people in with more relevant information rather than focusing on a small group. And in fact, it's encouraged if it so happens that the session speakers are not diverse, they would be made diverse specifically with an organization like AABIP, because we pay a lot of attention to try to do that. So in terms of gender, department, their role, seniority, I think the most diverse is better. It doesn't always mean the more senior people, the better.
I noticed in submission A, there's Dr. Expert, Dr. Every Session, Dr. Busy, all from the same state and maybe from the same center. Is that a session you would
and all from the same center? Yeah. So we would probably add some diversity to that session because we want obviously diversity of thought. The one thing that I really do like about submission A is that they're covering multiple fields that apply to IP. So it has an IP physician, it has a pathologist, it has an oncologist, but I'd like to see opinions represented from multiple different centers.
And what about submission B? Dr. Studious, Dr. Bang, Dr. Every Session, Dr. Scopy. I noticed that person is an alternate and from out of the country. Can I do that?
Oh, that's totally possible. Now every conference may have restrictions to how much, in person and in, virtual they can do, but that's very appreciated. This kind of session where it's spanning countrywide and across the seniority, I think it's very appreciated. I think our sessions choices look almost like a mix of both of submission A and B minus the same centers.
How about Jen? Do you have any advice for people as far as faculty? Maybe I don't know everyone in IP. What are your thoughts on how to approach that?
Yeah, I think from the IP standpoint, or the IP fellow standpoint, I should say, I think this can be a great networking opportunity for someone who's very young in their career. So early faculty, fellow level. I've been surprised by how many cold emails get responded to. And one of the things that I'm curious about with the panel, Hans, you asked, do you email them ahead of time? I always have, just to connect. It's another way to network, even if my session proposal is not selected. And so I would encourage junior submitters to take advantage of this opportunity to kind of connect with people in the field.
And then, so Laura, if you get an email from somebody you don't know and they ask you to be part of a interest in being part of a submission, what are your feelings? What are your thoughts?
Yeah. So I'm usually happy as long as I'm going to the meeting to be involved. And I think depending on where they are in the submission process, if they haven't submitted it yet and it's something that they're working on, I'd love to be involved in actually helping shape that session to make sure that it's a session that's the best quality to be accepted.
Okay. Can I leave it blank? Can I leave the faculty blank in my submissions?
So when you are submitting sessions on the website, you are going to need to list a certain number of speakers and alternates. That doesn't mean that you're going to notify every single one of them, especially maybe you don't notify all of your alternates, but you will need to at least assign some names that fit those content areas. And you can always reach out to individuals in the field who maybe can give you best recommendations for who might be a good fit for what you're thinking of.
Right, right. Okay, so just moving forward, a few basic principles. What are some of these basic principles?
Yeah, I would chime in here since I helped create a slide. So for me, you know, when I think of a proposal, is ultimately, how do I know if that's successful? And really what you see on this slide is all the things that you want to put effort into as you're writing the proposal. And, you know, one of the first questions you asked today, Hans, was how long does it take? And I think Jen answered that appropriately. It depends on how familiar you are with the topic that you're proposing and the faculty, and how familiar you are with the educational principles, writing learning objectives. So I don't have an answer for that. I mean, hopefully just a couple of hours, because we are busy clinicians. But the more effort you put into it, the higher the likelihood is we will get accepted, because it will be a good proposal. To write the session description, to come up with a good title that's quick and easy, that makes people curious, but still you articulate your core message in the title, that takes effort. To identify the knowledge gap and be able to articulate it, that takes more effort. I found that as the most challenging part of a submission. Learning outcomes using, you know, actionable verbs, using Bloom's taxonomy, that takes effort. Thinking diversity of thought, which Laura talked about, and that comes with diversity from gender perspective, race, geography, institution, you know, level of training. That takes a lot of thought as well, you know, and not just propose names that we're all familiar with. But I would articulate here that subject matter expertise and familiarity with a certain product that's being taught is important. And then you start with that, because ultimately what brings people to the room, people do want to learn from experts in the field. And operating on that principle, then you start diversifying. And then we talked about how to engage a strategy, how to engage the audience, and that takes a lot of thought and time. Now, what I think the good news is in writing a proposal that takes time and effort now is that you pretty much have the entire outline of the session. And then, you know, several months from now, when you're actually working with the entire panel and creating the presentations of that session, it will be much, much easier.
Yeah, I think so. I think these are great pearls, and thank you for preparing this slide for our audience. I'm going to bring up another slide, and I think this is a slide of maybe of an example of some of those things that Tim just talked about. But I saw an interesting question that just kind of came in, and I want to ask all the panelists to give me one thing that they should absolutely not do when they submit a session, because it's going to get denied. And Jasleen's the first person on my left, so I'm going to ask Jasleen first. What's at least one thing nobody should do?
So don't submit incomplete proposals. You know, don't leave blanks, because it sends us a message that this was not thought out properly, and then there are similar proposals there. So it's easy to overlook an incomplete one and give credit to the one that was worked on most.
Okay. What about Laura? One absolute don't do this.
I think we've already touched on this, but don't submit a session that's all one gender, all one institution. Those types of things. We want to see that diversity in the sessions.
And then I have Tim.
Yeah, I mean, this is exactly what this slide shows. You know, I just had the opportunity to speak at an ENT conference in Nashville yesterday. And the session I was part of had 2 women, 1 African-American speaker from 3 specialties: thoracic surgery, pulmonary, and ENT. And again, it was a multidisciplinary team talking about tracheal stenosis, and we encourage that. We've done this successfully in the prior AABIP meetings, and we should continue to do that. promote that cross-disciplinary and interdisciplinary sessions. The pictures that you see here are things that you may want to start getting creative. Like the picture in the middle with the Scan Me, these two speakers that talked about cough, by the way, at the ENT conference, chronic cough. They shared their handout with a QR code. I thought that was original. It's the first time I see that. And then, by the way, the room was packed, as you see at the top left, for a chronic cough session at an ENT conference, which make me reflect on the fact that things that are common and bothering people, patients, and the things that we see in clinic are still of interest to a community at large. So for us, maybe we should see a session on how to manage multiple GGOs, or I think we need to start thinking common things that are still gray in terms of publications that will raise interest. And then the pro-con debate, I took a picture of the door promoting this pro-con debate at this ENT conference. Your sleep physician should be an otolaryngologist, a pro-con debate. It was absolutely fantastic. Both speakers presented arguments with data, and then there was a rebuttal. It was very engaging. But what I found interesting was how provocative the title was. So I think there is something to learn from our colleagues from other specialties, and many of us attend other meetings. If you get ideas anywhere else at your local institutions from other educators, bring them on. The templates that you saw earlier are suggestions, and we're going to show adaptive expertise and modify them as necessary to accommodate your request if the proposal is well written.
Right. So I want to hear from Darlene, then Jenn, about don't do's for session submissions.
So it gets harder when you're at the bottom of the panel because all the other things were already taken. But the thing that came to mind was just not to, again, go back to what you're trying to accomplish. I think Tim mentioned that, like, what is your outcome? What are you hoping people walk away? So you have to remember that you're constrained by time. You can only do so much. So keep it straightforward to a specific area and don't try to cover too much, right? You're probably not going to cover all of nodules in one session, right? So is it going to be solid? Is it going to be GGOs? Is it going to be mixed? Are you going to be diagnostic or interesting therapeutics, or try to make sure that it's something that you can actually attain in a session. So that would be something that would otherwise make it really hard to accomplish if you try to go just way broad.
And then Jenn, I can't wait to hear your wisdom on this
Last
topic.
but not least. Yeah, I think I would say don't write an abstract, meaning, we're very used to writing scientific papers. This is really, I think Jasleen said it best, we're painting a picture of what that session is going to look like. So talking about some of the gaps in knowledge are certainly important, but also bringing it to the next level. How do we then make this an interactive experience, an engaging experience, and trying to paint that picture for the people evaluating these sessions.
Fantastic. So my one advice is don't be afraid. Don't be scared to submit. So submit a session. No one's going to laugh at you. It's you have nothing to lose, but a lot to gain. So for those people that are afraid, here's a strategy for a submitter. And what is this Scan Me thing? Who wants to talk about that?
Yeah, so if you guys scan this QR code, it will jump you to a shared Google Doc. This has been a strategy that's been incorporated in some of the groups that I've been a part of, and Darlene can speak to this as well since it's our same group. But this has been a great way for people to connect on topics that they may not know others are interested in. So that document will have contact information, but also a bit about what you're interested in proposing. And so you can throw out an idea there, see if there's others who are interested in that, who are able to enrich it in a different way, a different perspective. And then that group can then form separately using that contact information and hopefully generate a very engaging, high quality session proposal.
Wow. So this can be a team sport. You don't have to go at it alone. You can kind of work with somebody and submit something together, maybe include them in a session and they include you in a session. And all of a sudden you just doubled your appearance at the AABIP meeting. Is that a great idea or what?
It is. I was just going to add one thing to what Jen said. Using this has been how I've met people from other institutions, right? You guys have highlighted so many ways of that it has to be diverse and different age levels and expertise. And this really allows you to find people who may have a similar interest, but be at very different stages in their career in different institutions. So I would highly encourage you to check it out.
Awesome. Any other last bit of advice for strategies for submitting? I think we got 1 minute before Dr. Shafiq hops in.
I think I would just like to say that whatever you submit, whether it goes through or not, whenever we read it, we truly appreciate you taking the time. So please don't hesitate to do that, even if it's your first time. And if it is your first time, whether it goes through or not, it will serve as an outline of what will come in the years to come. So you can always build on it. So never be scared to take that first step.
Sounds a lot like dating. Just ask him or her out. And if that person says no, just ask the next person. That's bad dating advice for me. I've been out of the game for a while. Dr. Shafiq, please take it away before I embarrass myself any further.
That was a great way to end. Thank you all again for joining tonight and for sharing some of your time and your expertise. I know this is a topic that is of use to many of us. I certainly learned a ton from listening to all of you today, and I know that I'm now much more inspired to write session proposals and do them right. Thank you very much. Let me try to advance my slide. Now, if you found today's webinar helpful, you know that we have a whole library of these webinars. So please, please, please go to the aabroncology.org website and become a member. And once you become a member of the AABIP, you will have access to the whole compendium of webinars from the past years, including several webinars from earlier this year. And finally, we've got an exciting slew of additional webinars coming your way as well. So we do hope that you will be joining us again. Look out for the announcements as the dates become finalized in the coming days. Thanks once again, everyone, and hope to see you again soon. Have a lovely rest of your night.
Thank you.
Thanks.